So now let us see what is Cor Pulmonale. This is the term which is mostly used in respiratory medicine as well as in internal medicine, Cor Pulmonale. And sometimes this might even confuse us as to what it really is. So now I will tell you what really is Cor Pulmonale. Cor Pulmonale is nothing but when you have a heart failure, but the heart failure is not because of a problem in the heart. It is because of a problem in the lungs. So when you have a right heart failure because of the problem in the lungs, then it is known as Cor Pulmonale. So let us see what is Cor Pulmonale. How does it happen? So say for example, here in the lungs, the patient is having some pathology. So for example, they are having cystic fibrosis or bronchopulmonary dysplasia neonate or anything. I will tell you in detail. But the pathology is such that there is intense vasoconstriction in the lungs. The pulmonary vessels are undergoing intense vasoconstriction. In that case, what happens here in the heart? The heart is supposed to, so this is the right atrium and this is the right ventricle. The right ventricle is supposed to pump blood to the lungs through the pulmonary artery, right? So because of intense vasoconstriction of the pulmonary vessels, the right ventricle is not able to pump blood into the pulmonary artery, or in other words, the afterload is so high such that the right ventricle struggles to pump blood into the pulmonary artery. For a while it can be compensating, but after a while it results in right ventricular failure. So the right ventricular failure following a lung pathology is known as Cor Pulmonale. So any lung pathology which causes intense vasoconstriction of the lungs can result in Cor Pulmonale. So let us see what are the reasons. So it can be because of cystic fibrosis, first one, or any fibrosis in general. So any pulmonary fibrosis can also result in vasoconstriction. So why should a cystic fibrosis or pulmonary fibrosis result in vasoconstriction? When there is a fibrosis of the lungs, that means that part of the lung is not fully oxygenated. We know about a concept known as hypoxic pulmonary vasoconstriction. It is basically a protective mechanism where when that part of the lung is not getting oxygenated, then the vessels which are surrounding that alveoli, say I will tell you, so this is the alveoli, fine, and these are the vessels. So when this alveoli is not getting oxygenated, then this vessels, instead of maintaining the caliber, it will get vasoconstricted. It will get vasoconstricted. So this is how generally it happens. So similarly in cystic fibrosis and pulmonary fibrosis, the pulmonary vessels undergo vasoconstriction. But if it is only in a part of the area, then it is definitely a protective mechanism, because the blood is shunted away from the vasoconstricted area which are adjacent to the alveoli, which is not getting oxygenated well, to those areas of the alveoli which are getting oxygenated well, right? That is how the concept is. But when the entire lung is undergoing fibrosis, or one half of the lung is undergoing fibrosis, then in that case, due to intense vasoconstriction, the afterload increases and the pulmonary artery, which is supposed to pump blood to the lungs, it is not able to pump blood efficiently because of the vasoconstriction over there, and the right ventricle also struggles, thereby resulting in Cor Pulmonale. So this can happen in these two conditions, and it can also happen in obstructive sleep apnea. Now you might be wondering what happens in obstructive sleep apnea. Obstructive sleep apnea, again the same condition. Because of sleep apnea, they are not taking enough oxygen during their sleep, right? So because of that, the alveoli doesn't get oxygenated. So as we saw, those alveoli which don't get oxygenated enough, the pulmonary vessels undergo vasoconstriction. Because of the vasoconstriction, the afterload increases and the right ventricle struggles to push blood through the pulmonary artery into the lungs, thereby resulting in Cor Pulmonale, because the right ventricular eventually fails. So this is the other condition. And if they want you to think in this angle, like Cor Pulmonale, sometimes they might even give you like the patient has 100 years of smoking history. So this can even be result in Cor Pulmonale. So in neonates, how does this present? Neonates can present with bronchopulmonary dysplasia. As the name says, the bronchus and that entire framework as well as the pulmonary system which are adjacent to it are dysplastic, and naturally it is not getting oxygenated well and it is undergoing vasoconstriction. So this is what you should know about cor pulmonale. Now I would like to tell you that when there is a right ventricular hypertrophy, so failure in the sense initially it will try to compensate by getting hypertrophy and trying to push blood through the pulmonary artery and trying to overcome that afterload, right? So when there is a right ventricular hypertrophy, how will the X-ray be? The X-ray, when there is an isolated right ventricular hypertrophy, the X-ray will be a boot-shaped heart. The boot shape is because of the right ventricular hypertrophy. Fine. So this is the right ventricular this is how the right ventricular hypertrophy will present. Sometimes if there is a COPD, if they have a very severe smoking history, then how does it present? In COPD there will be hyperinflated lungs. The hyperinflated lungs will push the heart to the midline, and with the maximum impulse is felt at the subxiphoid space. That's how that X-ray can be. So we can even call that as tubular heart. Tubular heart is seen in COPD, and this can lead to cor pulmonale. This is another one. Right? Now you should again know about something about endothelin, bosentan and nitric oxide. So I will brief you about it. What do you know about endothelin? Endothelin is nothing but it is a vasoconstrictor. So in some patients where there can be primary pulmonary fibrosis, that is, they are having a pulmonary fibrosis without any obvious reasons, like there is not any other pathology like cystic fibrosis to cause this, or the patient is not a smoker, is not a COPD. Then why should the pulmonary vessels be in a hypertensive state? What is the reason behind pulmonary hypertension? There is no reason, and there is no etiology for it. Therefore, that is known as primary pulmonary hypertension. The mechanism behind the primary pulmonary hypertension is there is increased endothelin within their lungs, which is resulting in vasoconstriction. This is one we should know. So what is the treatment in primary pulmonary hypertension? We have to combat this endothelin. We need to have a drug which will antagonize endothelin. That drug is Bosentan. So Bosentan is an antagonist of endothelin. Now, what do you know about nitric oxide? Nitric oxide is something which will vasodilate the artery, the vessels. So you should know that in pulmonary hypertension, the nitric oxide is obviously going to be decreased because it results in a vasoconstricted state. So therefore, the nitric oxide is decreased. So this is in brief about the cor pulmonale, and it is just a small summary.